Um, okay, in light of this current surge, is the hospital still struggling with PPE?
Yeah, well, I don't know if I'd say still, because early on in the pandemic, I think I mentioned to folks that, I mean, I don't know if anybody normally wears an N95 mask during non-COVID time. Even during the flu season, our staff don't wear them. You generally only wear an N95 mask when you're taking care of a patient with tuberculosis or measles, something of that nature. So we had very little N95 masks in stock. Definitely face shields, rarely is a face shield ever worn. So we started out, as most every other hospital did, with a very limited supply of personal protective equipment, but it was just enough for what we needed, and generally just in time. If we needed more, we just restock and we get it like that. But then everything broke down, all the supply channels broke down, and we found ourselves really struggling to get the PPE we needed. But then over time, production increased, supply chains settled down, and we started accumulating quite a bit in N95, surgical masks, shields, gowns, so forth. We were actually building up a very nice supply that we would then retain to help us in the event that we saw a resurgence in this. So now we've seen that surge arrive, so we definitely are consuming a significantly greater amount of PPE. We have staff wearing fresh N95 masks every day. Surgical masks, you literally, one time now, you put it on, you take care of a patient, and you throw it away. So we were able to go back to that, but now because the surge has arrived, those same supply channels are now starting to break down and clog up, and they're falling behind in manufacturing. So we are starting to feel the squeeze in PPE. We're okay now, and if things were to stabilize, we'd be okay, but we certainly have lost that reserve stock that we had been working hard to build up. The place that we're really struggling right now is the COVID testing supplies. So we run two COVID antigen tests on two different platforms, the BD Max and the Abbott ID Now. And so those are the two platforms we run to test to see if somebody is positive for the virus. And unfortunately, those supply chains are also being greatly disrupted. And we were doing a very nice job building up inventory there. We were able to freely test all of our employees, our physicians, our patients, testing just about anybody that was coming to us. And that now is changing dramatically. So we are running down to very low supplies in our COVID testing kits. So we're having discussions in the command center right now, okay, what can we change? What should we start sending to the county? Should we start sending more to commercial labs, which I understand is incredibly frustrating because they're overwhelmed as well. They're taking 14 to 17 days to turn a test around. I hear stories sometimes even longer than that. We're able to turn around same day or next day. The county is generally next day or 2 days. They're within 24 to 48 hours. They can do 300 tests a day. They've significantly upgraded their analyzers, and so they've got a lot more testing capability. But they also are being squeezed on test kits. So we're trying to think, what could we do differently to preserve this testing ability? Because we've got to be able to test our healthcare workers to protect our patients and protect so we don't spread it to other healthcare workers. And we've got to be able to test our patients to determine how we best treat them, where do we place them. So we're working hard. Randy Coca, bless him, for the incredible work he does there. I just got an update this morning on the Kaweah Sophia 2 antigen test, which is, again, potentially a breakthrough game changer. It's the one where we move from doing the deep nasopharyngeal to the just inside the, what they call the nares, inside the nostril. That's a completely different type of antigen test, but one that's proved to be pretty reliable, pretty accurate. We have signed the contract to become one of their testing sites, looking to acquire 9 analyzers and placing orders for their test kits. And we're very hopeful that 1st of August they will come on site to start the training. But as Randy was saying, as you can imagine, this is national news. And Kaweah is overwhelmed right now with interest and orders.
Right.
And we fear that the federal government is going to step in like they did with the Abbott ID Now and kind of commandeer
Right.
the inventory and decide
Right.
who gets it and who doesn't, which is kind of what we're feeling a little bit right now. So a lot
Okay.
more to come on that.
Okay, thank you, Gary.